Hi, my name is Dr. Vikram Gupta, and today we're going to talk about uterine fibroids. This is a very common but relatively underdiagnosed condition that I think having an increased awareness will make a big difference. I had a patient come in a few weeks ago. She's a 28-year-old young woman who had been complaining of a lot of constipation, bloating, pain in her stomach, and had been missing a lot of work, was having difficulty sustaining relationships, and was beginning to get very depressed. On examination, we obviously discussed more about reasons why she might be constipated or bloated, but she also looked very pale. And when I asked her about her menstruation, she said, yeah, it's very heavy, but I thought that's normal. Now, that's another thing we will talk about at some point, that what is normal menstruation and what to expect. But when we examined her further, it turns out her blood count was so low that it was causing her so much fatigue and tiredness and making her feel like she was carrying 100 pounds all the time. Now that could be you. We see so many people who struggle through day-to-day activities but feel that they're just not getting enough sleep. So when we examined her further, we found that she had these bulky tumor in her uterus, which we call fibroids. We had her see a specialist and she had the fibroids taken out, and today she is living her best life. She's not missed work in a whole year. Now, what are fibroids? Now, fibroids are basically a tumor which is not cancerous that grows in the uterus. The uterus is where the baby develops when you're pregnant. Having fibroids most commonly will cause excessive bleeding, menstrual bleeding. The periods can last for weeks, and sometimes a little bit of spotting will continue for months. It can also cause a lot of pain. It can cause a lot of pressure-like sensation, and sometimes if the tumors are big enough, they can push on the intestines or the urinary tract, causing symptoms like constipation, bloating, difficulty urinating, and people don't even suspect that this could all be related to fibroids. Fatigue is a very important symptom that young women tend to experience because of low blood count, because the excessive bleeding that is caused by these fibroids, the body is not able to keep up with making enough blood as opposed to how much it's losing every month. Most women have menstruation that lasts from 4 days to 7 days, and initially obviously it's heavy, but it should subside every day, and by the end of 5 to 7 days it should just be down to spotting. Now, the exact cause of fibroids is not known. Some people have a genetic component, but the exact cause is not known. So what can we do? The most important thing is to recognize. You should know that if you've been feeling tired and you have pain, pressure, sometimes pain, pressure in the lower part of the belly, or you're just having very heavy periods, we should look for fibroids. Your gynecologist can order a simple test called an ultrasound, which can help identify these tumors. Now, depending on your age and how many children you have and desire to have more children, your gynecologist can offer multiple options for the treatment of fibroids. Mostly, if these fibroids are relatively larger in size, or if they're causing significant bleeding, then they can be excised, which means that they can be removed either partially or in certain circumstances the whole uterus may need to be removed. Fibroids are not cancerous. These are not non-cancerous tumors, but they cause multiple other symptoms that tend to affect the quality of life, and people can be dealing with these for many years. Some of my patients that I've seen have been dealing with these for over 10 to 15 years. Hormones don't really play a direct role, and it's more the menstrual cycle that affects how much bleeding happens. But we know that these fibroids sometimes tend to shrink on their own after menopause. Also, sometimes the use of oral contraceptives is a treatment option at a young reproductive age to basically regulate and control the amount of bleeding that occurs. And if they're not extremely large, then reasonable quality of life can be maintained with fibroids. Unfortunately, fibroids can also cause infertility in women. This is basically because they are occupying space in the uterus that's reserved for a baby, and people can experience miscarriages due to that, or just difficulty conceiving in the first place. Now, this doesn't mean that people with fibroids cannot conceive or cannot give birth to healthy children. It's just that they can play a contributory role. So I hope this basic knowledge of fibroids will be helpful. If you or anyone you know might be suffering from fibroids or from any of the symptoms that I've mentioned, please seek medical help. This is treatable and it can improve your quality of life to a large extent. If you like this video and if you feel that someone you know can benefit from this information, please share it with them. Please subscribe to my channel and I'll have more content coming your way. Thank you.